The Family Health Centers of San Diego was awarded close to $1 million in federal grant money for the Connecting Kids to Coverage Outreach and Enrollment program. They are one of 9 organizations throughout the state to get a health coverage outreach grant to prepare for the country's new health insurance marketplace. Joining me from Family Health Centers of San Diego is Jeanette Lawrence Shea. And Jeanette, welcome.
Thank you. It's nice to be here.
Let's just jump right in. How many uninsured kids live in San Diego, and how many of them might be eligible under this outreach program?
So there are about 60,000 kids that are uninsured in San Diego County, and our goal is to work with the 40% approximately that might be eligible for Medi-Cal.
So that's nearing 30,000 children.
Correct.
Okay. What sort of Medi-Cal services or medical services are covered under the health insurance plan?
Sure. So when a child gets Medi-Cal, it basically covers all of their health care needs, including medical care, dental care, prescriptions. It's a comprehensive coverage program so that kids really could get access to any health care service that they could possibly need. And we at Family Health Centers of San Diego offer those services through our network of clinics.
What qualifies a child to be able to participate in Medi-Cal?
It's primarily income-based. They also need to have residency, legal residency here in the United States, and then based on their family circumstances with income.
And I'm sure that if you look at the 30,000 out of the 60, let's just take that number, what are some of the key issues that basically keep these families from getting their children enrolled?
You know, one of the big challenges is just the forms. They can be intimidating. It's a large packet of information. If English isn't your primary language or you have trouble understanding what they're asking for, there's also a lot of documentation that's required, including your citizenship forms, your income. Particularly the income can be confusing. So for example, you know, some people have W-2s and that's very easy, but if you work multiple jobs, it's hard to know what to count. And so what we try to be is just a really friendly support to the families to help them understand the forms, know what to put on them, and get them turned in on time.
And that's part of the way this $1 million is going to be spent, right?
Correct. So the grant is for a 2-year period, and it will help us to hire additional staff that can work with families to help them complete the applications correctly the first time and get them in.
What sort of coverage gaps do you see here in San Diego among the communities?
Well, in a lot of the communities that we serve at Family Health Centers, there's hardworking parents that just don't know about healthcare coverage. Oftentimes you find them in the lower income levels, but in the communities that we serve in the Central, East, and South regions, there's literally thousands of families that their children are eligible for these benefits, but they either don't know about them or don't know how to apply.
How's this outreach going to go? How are you going to go about it, and when will it begin?
Sure. So we're starting this summer to hire for the positions to get everyone on board. There'll be outreach workers out in the community working with our existing patients to make sure that if they're uninsured and already come to Family Health Centers, we can help them get enrolled. One of the other big pieces is we're working with people on their recertification. So once a year when you're on Medi-Cal, you have to recertify for the program, and that can be a difficult process as well. And so we know when they come and see us for medical care, we know when it's time to recertify and also help them get those forms in.
And did the forms come in various languages? So is that a barrier?
They are offered in various languages, but again, it's that kind of human touch to help answer questions you have about what to put where on the form, and if, you know, a relative, if their income counts, if they're living with you but they're not a parent. There's many questions like that that we can help people simply answer and get the forms in okay.
Well, I know this grant is part of the Affordable Care Act. How is the enrollment changes besides this? How has anything changed now that you're anticipating this rollout?
Sure. So I think one of the most significant changes in California is that the Healthy Families program rolled into Medi-Cal at the beginning of 2013. So that means that all kids there, instead of having 2 options of Healthy Families or Medi-Cal, there's just one. As we go into healthcare reform starting in 2014, there will be a significant number of adults that are also eligible for Medi-Cal, so how they enroll their family will be a little bit different. And then families that make too much for Medi-Cal will now be eligible to apply for Covered California. And this outreach staff and our enrollment support will be able to help families with all of these programs to make sure they can enroll in what they're qualified and need.
Well, since we're talking about the Affordable Care Act, is there a penalty if the children are not enrolled?
There is a penalty if you're not enrolled in health care. It depends a little bit on your income level, whether you're going to get hit with the penalty. So for example, a family that makes less than $20,000 a year won't be penalized, but there are penalties for people if you make over that income level and you have been uninsured all year long. They start at about $95 per adult for the first year, and they change over time.
All right, some extra monetary motivation, we'll
Right.
put it that way. Jeanette Lawrence Shea, thanks so much for
You're
this
welcome.
update.
Thanks.